While American unemployment soars in the pandemic, many are turning to food banks for help. In Los Angeles today, nearly 2,000 people lined up for donations, many of them there for the first time. NBC News correspondent Steve Patterson joins me now from where the food bank operates. Steve, tell us about what you've seen there today.
Well, a lot of thankful faces, Savannah, people that have been underserved and really in a hard situation because of the coronavirus. The job market has really yet to fully recover or even halfway to that, to really being able to say that things are back to normal or anywhere close to normal. And you could really see that today. About 1,400 people, they estimate, came through here. This is the L.A. Regional Food Bank. They've been doing this really since the pandemic started, serving, hundreds to thousands of people at one time. They estimate that they've probably handed out some 90 million pounds of food just in the pandemic alone. That equates to about 70 million meals. Today was no different. We spoke to people in line. A lot of them, it was their first time getting assistance like this, but were just put out by the pandemic. Others have taken advantage of it before, but we're skipping meals, where we're eating things that were kind of in their cabinet left over instead of being able to come around the table and have a full meal, in many cases with their children or with their grandmother or with their family. And so this really gave them the opportunity to do that. And that's what's so special about this. But unfortunately, it also speaks to the fact that coronavirus is still, in many cases, surging, but also suppressing really a lot of what's happening in the job market here in California. This is a market that really depends on the entertainment business, on tourism, on hospitality, and a lot of that is still shut down throughout the state. You look at the state, we're still hovering at about a 13% unemployment rate compared to the rest of the country, which is at 10%. And if you dial in LA County alone, it's at about 17% unemployment. So looking, and comparing to the rest of the nation, a lot of people are still in dire straits here. This, thankfully, is one of those opportunities where people can get something to eat, put some food on the table for themselves and their family. So it was good to see that, but it still speaks to the fact that things are still bad here when it comes to the job market. Savannah?
Steve, I love the way that you just put that, humanizing it. It's not just those pallets and crates and boxes behind you. It's people being able to have the opportunity to have a meal with their family. Now, I know you spoke with the CEO of the LA Food Bank. What did he tell you?
He was optimistic about what they've been able to do and what they're able to continue to do. But again, he said basically that they've been going nonstop since this started in a way in which is very dramatic, in a level in which we really haven't seen since the Great Recession in 2008. But even now beyond that, just because the level of need is so high and it continues to be so high. Back when the unemployment rate was even much higher a few months ago, they've still seen this sustained pressure of people that need help, and it doesn't appear to be going anywhere. And even if this were to end tomorrow or next week, they would still need to be able to feed people because the job market, we see that lag where it takes a while to recover, even after things have gone essentially back to normal, or at least getting to back to normal. Here's what he said about just what the need is. Listen to this.
The need just spiked up significantly right away. Plus 80% increase distribution when the pandemic first started. And now we're at a 125% increase on food acquisition and distribution. So we see it at this really historic level for the food bank.
125% increase. You heard it there. That is an incredible, astronomical spike that they had to deal with. But they've done it really efficiently. I mean, behind me, this thing went like a well-oiled machine. You couldn't even really tell that 1,400 people came through because they're so efficient at doing it. They do it several times a week. So they've been feeding people for so long that they essentially know how to do it. But again, he's saying that this thing could continue for a very long time. Luckily, with their partnerships, both at the state, local, national level, and then with the volunteers that have really stepped up, with the donations that have stepped up in this pandemic, they're able to sustain this amount of pressure. Savannah?
Steve, thank you so much. And again, I just love you really humanizing it, making us point out that, these are meals for people to have with their families, things, anything normal, anything that's going to get people through. They need to eat. They need these things. Thanks for your reporting there.
That's what it's all about, Savannah. Thank you.
The coronavirus pandemic hasn't treated everyone equally. Black Americans are twice as likely to die from COVID-19, which makes it even more important to make sure a vaccine works for everybody. NBC News correspondent Ron Allen sat down with the director of the National Institute of Allergy and Infectious Disease, Dr. Anthony Fauci, who we've all come to know, to talk about that earlier today.
How important do you think it is for people of color to be involved in the testing process of these potential vaccines?
I think it's extraordinarily important for so many reasons. First of all, given what we see and how this disease and this infection has ravaged the minority community, that an intervention such as a vaccine is for two reasons. First of all, the incidence or the likelihood of getting infected is greater in the minority communities, particularly African-American communities. And then if they do get infected, they have a much greater likelihood of a severe outcome, including hospitalization and death, because of the underlying conditions, which are much greater and much more represented in the African-American and other minority community. So the benefit of a vaccine is clearly important for the minority community. And if you don't have them represented in the clinical trial, then you will not have definitively proven that the vaccine is safe and effective in them. You can assume that if it is safe and effective in the white population or in the non-minority population, that it would be effective. But you really want to know that you tried this vaccine in a well-organized, placebo-controlled trial, and you know that it works in minorities and that it's safe in minorities. That's the reason why it's so important to have them involved.
And we are not involved. The numbers are about 10% based on what I saw from the COVID Prevention Network. What do you say to people who just don't trust the process and worry they're going to be treated like a guinea pig?
You know, you've got to put a lot of effort into community engagement and community outreach. And you've got to engage people, not only people like myself and people who are, you know, essentially official people, but you've got to get people who are at the community level and are trusted by the community. It's extremely important for them as individuals, but also for that demographic group. We need to make sure that we prove beyond a doubt that what we're doing is safe and effective in them.
There are concerns that the White House is pushing the FDA to approve vaccines faster than the science would suggest. What's your response to that?
You know, if you look at the commitment of the FDA, who've been explicit in being very clear that their decision on the regulatory aspects of when a vaccine would be made available to the American public is going to be based on science and hard data and evidence. They've made that very, very clear, and I take them for their word that they're going to do that. And there's another issue there that I think the general public needs to appreciate. There are data and safety monitoring boards, which are independent group of individuals who, in fact, look at the data intermittently and make recommendations as to what the disposition of the trial is.
But do you worry the process has become too political with an election approaching?
You know, I think there's a perception of there being political, but I don't see that as being something that's going to be practically playing out. If you have the commitment of the FDA and you have the commitment, I know the Data and Safety Monitoring Board people, they are independent and they are very, very committed to making sure that science prevails and not politics.
The CDC is telling states to be ready to distribute a coronavirus vaccine by November 1st, just days before the November election. NBC News medical contributor and internal medicine physician Dr. Lippy Roy joins me now. Now, Dr. Roy, the CDC says this would apply to healthcare workers and high-risk groups. That's that November 1st date that we're talking about. Who falls into these categories?
Hey, Savannah. Yes, the recommendations are that healthcare professionals, as well as other essential workers and national security staff, would be in that first tier to receive the vaccine. And then after that, it would be people over the age of 65, Native Americans, and other racial and ethnic minority groups. Those would be the tier of people receiving the vaccine. In addition, men and women who are incarcerated. So those populations are considered high risk individuals at risk for getting COVID infection.
Now, let's say there is a vaccine available by November, and let's say you have some of those patients who are high risk. Would you recommend it to them?
You know, that's the $1,000,000 question, isn't it, Savannah? I mean, you know, we heard Dr. Fauci express his confidence in the FDA and the strict regulations that they're going through as far as safety, as well as he cited an independent safety board that looks at the data. That said, I most certainly trust Dr. Fauci. That said, you know, the other hard facts are the fact that we have never, over the course of human history, developed and distributed a vaccine directly into humans, inoculation to humans, in under 4 years. And the fact that we're now thinking of developing and distributing a vaccine for COVID-19 in less than a year, I think it's reasonable why so many of us public health and medical professionals are skeptical without seeing truly the data in large populations of people, including healthy people. Because remember, this vaccine, the goal, the intent of this vaccine is to go out into hundreds of millions of people all over the world, including adults and children. So we need to take every precaution possible, Savannah.
All right, Dr. Roy, I'm not sure you just instilled very much confidence in me, but thank you for honestly assessing it, because I think we're all just very confused. Like, should we inject something like this so quickly after it being developed? Realistically, when do you think a vaccine could be available to everyone? If you're not in that healthcare worker or high risk group, when could you see this come in?
And I actually didn't really answer your specific question. Was would I feel comfortable either giving it to myself, my patients, and I do take care of COVID-infected patients here in New York City, or to my own family members. And the short answer is I would not feel comfortable until I get absolute assurance of that the vaccine is safe, has been adequately tested in thousands and thousands of people, and you really need time to really assess for adverse consequences. And to answer your other question about when would it realistically be available to the average American, the average member of the public, again, the experts right now are at the FDA and CDC, NIH are saying they think by November, but honestly, again, if you look at history and vaccine development over the course of history, it takes years, and so I really don't think it until 2021. But I'm happy to be proven wrong as long as the vaccine is safe and adequately tested, Savannah.
Now, a lot of these different vaccines are in this phase 3 of their trials, but that doesn't necessarily mean that we know for sure that they're safe if they haven't gone all the way through that phase 3. What could go wrong here?
I hate to be a Debbie Downer again, Savannah, but there's a lot of things that can go wrong. So this is why we need phase 3 trials. And just so your viewers are really clear, phase 3 really tests people in the range of 30,000 people. And it's not just the number of people, but it's tracking them over time to look for any type of adverse events, anywhere from like mild side effects such as redness or soreness at the site of injection to severe complications, cardiac, neurologic. There's many types of complications. So there's many ways a medication such as a vaccine can go wrong. The other issues, though, Savannah, are really logistical, because if you remember from the data, the studies that are coming out from Pfizer, Moderna, is that this vaccine is going to require 2 doses, 21 to 28 days apart. So, and right now, if you look at polls, the average, I think only 40 to 50% of Americans are even agreeable to getting a vaccine, let alone come back about a month later for a second dose. And the other issue is that the vaccines need to be stored at -70. I think the Pfizer vaccine and -20 by the Moderna. It could be the other way around. But the point is that's an additional storage and shipping complication or logistical challenge. So there's a lot of issues that we really need to be aware of, Savannah.
Dr. Roy, thank you for your assessment. I so appreciate the honesty. Really, it's something that we all really got to hear, all of the potential things that could go right or wrong. Thank you so much for joining us.
Happy Friday, Savannah.
881,000 people filed for unemployment for the first time last week. Normally, that wouldn't be cause for celebration, but it's actually the lowest weekly total since the pandemic upended the economy. NBC News business and technology correspondent Joe Kent joins me now. Joe, hi, good to see you. Walk us through today's unemployment numbers. Are we seeing signs of recovery here? Is this, like I just mentioned, cause for sort of some hope?
Savannah, hey, it is a sign of healing of the economy, not completely, but another good step in the right direction. But 881,000 jobless claims, that number, you got to look at the context in two different ways. First, it's still about 4 times as much as the pre-COVID jobless claims that we would get week to week, say back in February or early March before things really hit. And the other thing, too, is that this number is lower because it's a new way that the Labor Department is calculating weekly jobless claims. They have this thing where they have to adjust for seasonality of hiring, say teachers going back to work or retail workers getting hired up for the holiday season. So that's also contributing to the drop in that number. So overall, moving in the right direction for the 6th week in a row, but still very staggering numbers reflecting the real human pain here behind the economic situation.
Yeah, absolutely. The pain, aside from, of course, the medical pain, is this one. And like so much in this pandemic, the recession isn't hitting all Americans equally. A big question going forward, what will recovery look like for different Americans?
Yeah, no doubt about it. As we've been reporting throughout this crisis, the people who are hurt the most in this economic disaster are people of color and women and people who have the lowest level of income, especially those hourly wage earners. So tomorrow we're going to get the August jobs report and we're going to get a really good sense of how things are going in a bigger picture sort of way. And we do expect 1.3 million jobs to have been added in August. So that's a good number. But again, you got to look at the context. We lost about 23 million jobs. What was it, back in March and April? And we've only gained about like 12 or 13 million of those back. So another 1.3 million in August would be a really good thing, right? But it's also still illustrating how big that gulf is. And when you think about the food lines that we've covered, that Steve Patterson's covering today, people trying to get just food on their table to survive. And now you're looking at an evictions crisis that's going on as we speak. You can see the reality of the situation is even though the numbers are getting better, it's still extremely painful for a lot of individuals out there.
Absolutely. Now, Joe, the Dow fell more than 800 points today, but the stock market had been setting records. What happened today?
Yeah, you really saw a big pullback in tech stocks. A lot of the companies we talk so much about, like Apple and Tesla, dropping 8-9%. You also had Alphabet, Google's parent company, dropping pretty significantly as well. Talking to analysts about it, they say that this is a healthy pullback. There was a lot of froth in the market, a lot of excitement, and some people were selling on the gains that they had made. This was one of the best Augusts in decades, according to one stock market analyst. So that's, again, where you see the divide. You see a stock market that continues, generally speaking, to be moving in a very positive direction. And then you also have so many people hurting at the same time. So certainly the stock market taking a hit today, but it's been a lot of up and down in the recent weeks. So we'll see what happens here. But the stock market, as I always like to say with Allison, it's not really reflective of the real economy.
That certainly seems to have been true throughout this entire crisis, Joe. And I'm sure we'll be talking to you soon once we get that jobs report. Thanks so much.
Thanks, Vanna.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.